Okay, so it looks like we are right at 3 p.m. So I will go ahead and get us started. It is my pleasure to welcome all of you to the Illinois Bone and Joint Institute's virtual event for Dr. Eric Chehab about COVID-19 and how to handle injuries during this time. So, we are so appreciative that you've all chosen to spend a little while with us this afternoon to hopefully learn a great deal more about the COVID 19 virus itself, ways to stay safe or to manage injuries when they happen, as well as how to access care during this time should you need it. As we hope all of you know, we are proud to say that our IBJI physician offices, physical therapy centers, MRI centers, and Ortho Access immediate care centers have remained open during this time. So we hope to give you some more information on the kinds of care that we're continuing to provide and how to access that care. So with that, it is my pleasure to introduce Dr. Eric Chehab, orthopedic surgeon with fellowship training in sports medicine and shoulder. Dr. Chehab will take you through a presentation that he has prepared, but if you have specific questions for Dr. Chehab, please enter those into the questions section of your control panel, and time willing, we will try to circle back and answer as many of those questions as we can at the end. So without further ado, I will hand it off to Dr. Chehab.
Okay, Maggie, thanks very much. I'm just going to share my screen here, and I hope everyone can hear well. Maggie, are you hearing me okay?
Yep, I can hear you.
Okay, so let's I'm gonna go ahead and get the presentation started, and I'm gonna not put myself up on the big screen here. So I'm just gonna turn off my camera, and I'd like to present to you how to handle injuries during the COVID-19 pandemic. Obviously, this global pandemic has changed the way we live fundamentally, and probably will for quite some time. So we've been seeing some pretty unique things during the pandemic that we wanted to share with you. Now, as I go through the talk, I'm going to talk a little bit about COVID-19. I understand many of us have COVID-19 fatigue. We keep tuning into this, and there's often an awful lot of information that's coming out on a daily basis. But I like to give just some background information about COVID-19, and then we'll move into how to handle injuries that occurred during the pandemic. So I don't have any conflicts of interest to disclose. There's nothing about this talk that is of any monetary value to me. What is COVID-19? Well, COVID-19 is actually the name of the disease, standing for coronavirus disease, 19 for the year that it emerged. The cause is a virus, and the actual name of the virus is the SARS-CoV-2 virus, which stands for Severe Acute Respiratory Syndrome Coronavirus. Now, the number 2 is there because there was a prior SARS coronavirus outbreak back in 2003. This virus is highly contagious, and it can cause a potentially deadly disease. An analogy that's useful is the disease is COVID-19. It's caused by SARS-CoV-2, similar to the disease of AIDS being AIDS, caused by the virus HIV. Now, we have a pandemic, which means that we have a worldwide outbreak, and an epidemic is when you have a communal outbreak, but that community can be described as a city, a state, or a country. That's what an epidemic is, but a pandemic is when the disease is worldwide. You'll hear the word novel, and that it's a novel virus because it's never been seen by humans before. The origination is believed to be bats. And there are a large number of coronaviruses that exist in animals, and they're grouped into 4 subtypes: alpha, beta, delta, gamma. That's not particularly important, but there are 7 known human coronaviruses, and 4 of them are very common and cause very minor symptoms, if any. And then there are 3 that are much less common that can cause severe symptoms. The MERS coronavirus, MERS, is the Middle Eastern Respiratory Syndrome virus that emerged on the Saudi Arabian Peninsula in 2012. There's a SARS coronavirus that we mentioned previously in 2003. And then there's the current SARS-CoV-2 virus, which we are dealing with now, which causes the COVID-19 disease. Now, the symptoms of COVID-19 are fever, cough, and shortness of breath. These are the main symptoms, and these occur anywhere between 2 to 14 days after exposure to the virus. And that's somewhat the problem that we're facing. If symptoms do not appear for 14 days, someone can be a silent carrier of the virus and actually spread the virus without knowing it. And that's what part of the reason why this is such a highly contagious virus and a highly contagious disease. Now, there are other symptoms that are caused by the virus, and these illness-defining symptoms include chills, repeated shaking with chills, muscle pain, headache, sore throat, and interestingly, the loss of taste or smell. There's some other curious symptoms that are developing. There's some bruising in people's toes called COVID toes. That's sort of the nickname for it. So they are not illness-defining symptoms at this point. But again, as more time goes on and the more that we learn about the virus, the more this symptom list may grow. Now, this virus spreads by respiratory droplets. So this is an extreme example of those respiratory droplets. And those respiratory droplets can be inhaled through your mouth or your nose and enter your body, or they can be on surfaces where your hands touch. And then viruses generally enter the body through touching your face. So it's by touching your mouth, touching your eyes, and touching your nose. And that's how viruses will generally enter the body. And so that's part of the reason why we have these recommendations from the CDC to try to minimize the spread of the virus, which is number one, avoid close contact so that the respiratory droplets that people generate while they speak are not being inhaled by you. Cover your coughs and sneezes so that you're not projecting your respiratory droplets, and avoid touching your face. Now, this is great advice. It's just incredibly hard to do. I remember being in medical school when we were learning about how viruses spread, where the teacher said, look, everybody touches their face. You can't avoid it. There have been studies done where people are literally told not to touch their face. They sit in the room for an hour, and people will generally touch their face, even though they're instructed not to, and even though it's only for an hour, generally between 5 and 10 times in that hour. We are cleaning and disinfecting surfaces. That's what we've been instructed to do, because when these respiratory droplets settle on a surface, you can disinfect them with cleansers. We're being asked to wear face masks, and the face masks are not to protect ourselves from the disease. They're actually to protect our neighbors from the disease. And we want to stay at home when you're sick. If you're experiencing symptoms, it's important to stay home. I'm just going to ask that people mute their microphone. I think we're having a little bit of feedback that's coming our way. And then please wash your hands. And washing hands will take those respiratory droplets off of your hands, and that's critically important. Now, the CDC website is absolutely terrific, and if you haven't visited it, I would recommend that you do so. On the CDC website, they instruct you how you can make your own home mask, which is quite easy to do. And this is what I did. I just sewed my own mask out of a pillowcase, and I actually wore it in the office for several days just to tell people, geez, this is very, very simple to do. And then risk factors for severe illness. Patients who suffer from lung disease, heart disease, who have immune compromise, obesity, older age, diabetes, and liver and kidney disease, they seem to be at much greater risk for developing severe illness. And the virus itself isn't different from country to country, but the host is. And so, for instance, in the United States, we have a very high rate of obesity and diabetes. And so we may find that different age groups are affected if we have a high rate of obesity or high rate of diabetes. While these people are at higher risk, meaning that they are vulnerable population, anyone can develop serious illness. And so that's another important factor to keep in mind. Now, everybody's seen this. This is exactly what we're trying to do right now by sheltering in place. We're trying to flatten the curve. And when you look at this curve, if you just let the virus go, if you don't take these extreme measures that we've done of sheltering in place, then the virus will go unchecked and it will spread very rapidly. And a lot of people will get ill at the same time. Again, the majority of people will have mild symptoms, but a small percentage of people, about 10 to 15% of people can get quite ill, and a percentage of those people can die from the virus. And so if you just let it go, you'll overwhelm the healthcare system. And we've become very close to doing that in places like New York. Now, by sheltering in place, we're actually not getting rid of the virus. We're simply moving the date down the road. We're biding time. We're buying a lot of time. But the hope is that during this time frame, something like this will happen. The development of a vaccine, the development of a therapeutic, more information about the virus and its transmission and how we can prevent it. And so what we're doing is, if something like this happens at the green line, we'll save all these people downstream from having been injured, and all these people upstream would otherwise have been hurt in the red. So you can see just the significant difference. Now, testing. We've heard an awful lot about testing. Testing requires people, places, and things. And those people, places, and things, I'm so sorry. Someone needs to mute their microphone. It's not me, I don't think, but I can hear an awful lot of banging in the background. So if someone doesn't mind just muting it. So testing requires people, places, and things. And the people are the ones doing the test. You need places to do the test, and you need things to perform the test, meaning you need swabs and test examples like this. Now, the problem is we simply just don't have enough tests. And we don't have a lot of people who can administer the tests. And, you need these separate places for the test. And so that's a significant issue. And testing, there are two types of testing. There's swab testing, which is via PCR, which is, are you carrying the virus? And then there's blood testing, which is antibody testing, meaning have you already had the virus? And so these tests are really different and really important to distinguish between the two. Swab testing with the PCR testing, again, is done by a nasal swab. And people who've had this test will tell you that it feels like your brain is being swabbed. And the antibody test is a blood test. And that blood test will tell you if you've already had it. It just takes a small blood sample to do it. Now, if we had enough tests, it would be really easy to take care of the virus. For instance, if each of us had a saliva test that we could administer every single day to ourselves, and it can tell us as we walk out the door that you do not have the virus, then you go about your day and you trust that everybody else has taken their saliva test and is not carrying the virus. And then if you take the saliva test and you're positive, well, you go back inside and you quarantine for 2 weeks. And if we had testing capacity, we'd be in a much better position to manage the virus. Now, and we all are familiar with that very bad optic at the Mayo Clinic of our vice president not wearing a mask. But he said that he was being tested frequently. And actually, that's the beauty of it. I mean, if you could only be tested, then you could live a more normal life. You could go to work because you can trust that your fellow citizen is also negative because they've also taken the test. So when you have enough tests, your life can be much more normal. When you have a shortage of tests like we have to assume that everybody is a potential carrier. And if that's the case, we have to keep everybody pretty much confined until we can figure out a better way. Now, a quick note about testing. There's about a 2% incidence of the coronavirus in the population where people have developed antibodies. This was a study that was done out of Santa Clara. And obviously, as time goes on, this percentage is going to increase. But that's what their study showed, about 2%. Now, a perfect test will never give you a false negative result. In other words, if I have antibodies, my test will always be positive and never be negative. Or if I don't have antibodies, my test will always be negative. I won't have a false positive. And so then the test can be 100% reliable. So in other words, if I have a negative test, I can completely trust that I do not have antibodies. And if I have a positive test, I can totally trust it. Now, instead, what happens is not every test is perfect. And the current antibody tests that are being slowly rolled out commercially have about probably a 20% false negative rate. So if you were to take 20% of the population, about 4 of them would test negative, even though they have the antibody. And the false positive rate is about 1%. So out of this population, about 10 of those 900 or 1,000 people would test positive, even though they don't carry the antibody. And so then if you fill in the numbers here, you can see that when you take a test that early on, when you only have this small incidence, it's not very reliable when you have a positive test. There's about a 62% chance that a positive test means that you actually have the antibody. And this is because we're very early on in the pandemic. Now, take a look here. We're just going to change the numbers a little bit where the incidence of antibodies is 10%, where 10% of people have been exposed to the virus and have developed antibodies. We're going to use the same exact test, which has a 20% false negative rate and a 10% false positive rate. And then as we fill out the chart, you can see that when you get a positive test now in that situation, that you have a 90% reliability that your positive test means that you actually have antibodies. So even though it's the same exact test, it becomes a number trick where the reliability of a test becomes better as more people actually have the problem. So, you know, that may be some of the things that you're hearing about the tests, that right now it's kind of a coin flip when you have it, but over time, these tests will become increasingly more useful and valuable to estimate the incidence in the population and to develop models that will allow us to live more normally and not flood the healthcare system. Now, the bottom line is if you want any more information about COVID-19, the best place that you can go is to the CDC website. So cdc.gov uh, has a terrific resource on coronavirus. So if you need to learn more, please go there as your first stop. They've done a tremendous job at providing information for the general public. Now, what do you do if you're injured? And the challenges right now is that we're trying to prevent the spread of the infection. So we are social distancing. And we've seen many people who've been injured who are scared to get treated because they're scared of acquiring the infection. They're scared of the facility. They're afraid they're not going to be able to socially distance when they're in a physician's office or in the hospital. Now, with the musculoskeletal injuries, it's perfectly reasonable to rest, ice, compress, and elevate, the RICE mnemonic. So generally, most musculoskeletal injuries, this is a reasonable place to start. If you need to, my God, you can make a splint, and a towel can make a terrific splint. If it's folded several times and then wrapped around the extremity, it can help splint the extremity. But we're afraid that so many people are doing this. They're just not coming in to see the doctor. That's not something that we would encourage you to do. And let me give you a couple of examples. This was an elderly gentleman who came in to see me about 5 days after sustaining this injury to his wrist. He really broke it. And by the time he came in to see me, he had massive swelling in his arm because he just couldn't use his arm. It hurt so much. He had it down all the time and all the water was going towards his hand. And so by the time he saw me, there was tons of bruising, tons of swelling, and it simply complicated the treatment for him. This is another patient that I saw just this past week who fell and injured her shoulder and sustained this dislocation. Now, this patient actually called the paramedics who helped the patient back inside. But as the pain continued for the next several days, they finally presented to me. And fortunately, we were able to put the shoulder back in place in the office. But she came with her son, and her son and she were both desperate to avoid the ER. And they got very lucky in this situation that we were able to do this in the office. But the point of this is don't make a problem worse by neglect. And that's kind of what we've been seeing because of the pandemic. And we really want to hammer that message home that if you do have a musculoskeletal injury that's not responding favorably to rest and ice and compression and elevation and maybe a soft splint, then please, by all means, get it evaluated. It's critically important. Now, the means of evaluation have expanded. You know, we talk about the ER, and we totally understand why people want to avoid the emergency room these days. But again, if an injury requires it, you go. We also have our walk-in clinics, though, and people have been have responded very favorably over the years to our walk-in clinics. We call it Ortho Access, and our walk-in clinics remain open during the pandemic to allow patients to be cared for their injuries. You can also just call one of our docs. We are still seeing patients in the office. Our schedules are truncated. We're spacing out appointments so that we're not crowding waiting rooms. And then also telehealth is an option that we just recently implemented over the past 6 weeks. Now, for Ortho Access and an appointment where you would come into one of our offices, it's important that you know that we are diligently and strictly following CDC guidelines. Patients get temperature checks as they walk into the building. They undergo a set of screening questions to, again, minimize the risk that they're carrying the virus. We're performing frequent disinfection throughout the office. Everybody is wearing a mask, and there's lots of hand washing and lots of hand sanitizer that we're providing to our staff and to our patients. Now, telehealth, I want to spend a little bit of time here because it's so new. And it's not just new for the patients, it's also new for the providers. And the U.S. Department of Health and Human Services defines telehealth as the use of electronic information and telecommunications technologies to support and promote long-distance clinical healthcare, patient and professional health-related education, public health, and health administration. Technologies include video conferencing, the internet, store and forward imaging, streaming media, and terrestrial and wireless communications. Now, the bottom line is we actually all have telehealth ability on our phones with a camera and a microphone, which is essentially what it requires. But the software that's provided makes it more HIPAA compliant, more private, and more conducive to a medical visit. Now, before the pandemic, the blue states were the ones that allowed telemedicine to be performed. And the orange and yellow states were the ones that did not allow telehealth to be performed. And so the state of Illinois, as you can see, had stuff in the works, but had not formally implemented telehealth as an accepted means of evaluation. Now, that all changed because of this. The pandemic, this virus changed everything. And now every state is blue. Every state has rolled out telehealth. And this was our algorithm for trying to figure out what to do with patients based on insurance. And that was on about March 25th. And about 2 or 3 weeks later, that algorithm became more complicated because every insurance company is now allowing telehealth visits and allowing for patients to seek telehealth care. And the good things about telehealth is that it obviously expands access for patients. So patients who have a condition can reach their physician or provider and start talking about their condition and get some real expert advice. It obviously is a socially distanced way of seeking care. It lowers risk exposure and it's very convenient. It simply requires a phone with a camera and a microphone or a computer with a camera and a microphone. Now, there are some drawbacks though. And for me, someone who evaluates musculoskeletal injuries, the main drawback is the lack of physical exam. Now, we are actually learning how to do some physical exams, and there are some academic centers that are really laying out the groundwork for how we can examine patients more thoroughly musculoskeletally through telehealth. So again, we're brand new at this. We're 6 weeks into it, but this is an expanding growth of how we can do a more effective physical exam, even though we're not laying our hands on you. We also are quite limited with tests. Remember that patient who had the dislocated shoulder? Now, you come into the office, it's very easy to diagnose it with an x-ray, but it'd be more difficult to diagnose over a telehealth visit. And so as a result, telehealth, we rely much more heavily on your history. So when you are having a telehealth appointment, it's really important that you think about what happened to you, how you're going to present your history, because your doctor is going to rely more heavily on your history and less heavily on their own physical exam and adjunctive tests. So keep that in mind. And the nuts and bolts of it is the same as you would have with any doctor's appointment. When you think about going to the office, you're actually agreeing to meet your doctor at a given time. You go into a waiting room and there you wait in the waiting room, then you're brought into a room and you meet your doctor. Now, on telehealth, the same idea exists. You'll be brought into a waiting room, whether it's web-based or some sort of app. You'll be asked to enable your camera and your microphone so that you can communicate effectively. So when that comes up, always allow it. And then when both sides are ready, the exam begins. And so think of this as just like going to the doctor's office. You're sitting in a waiting room, your physician comes on, and then the two of you are ready to evaluate and treat. Now, we use this platform called DocSeeMe, DOXY.me, meant to be DocSeeMe, Dr. See Me. And it's been a very effective platform. It just happens to be the one that we chose. There are hundreds that are out there. This is what I see. This is my waiting room. So on my screen, I see this. Now, I can invite people to my waiting room through email or through a text message or through a calendar invite, as seen here. And then basically we agree to meet at a certain time. What will patients receive? They'll receive this text message or email invite with this website. And that website is my waiting room. It's my personal waiting room. It's my permanent waiting room. So it's always there. It's just not, I may not be there on the other end. So that's why we have to make an appointment time so that we can meet at the same time. What you would do is you would click on that link, and then you'll be asked to check in. So this is like going to the reception desk at an office. You put your name into here. I put the name patient 0, and then you check in. You simply hit the green button. And then you'll be asked to enable your camera, because again, we need to see each other and be able to talk with each other. So you can enable the camera, and then here you are waiting. This is what you'll see. And most waiting rooms will give you some information about the doctor, and mine provides that as well. And look, the green light here says that I'm available, but I might be in with another patient. So just, if you don't mind waiting, very similar to what happens in a doctor's office. What I see on my end is that patient 0 is checked in, and I can see for how long they've been checked in. And I may have a list of patients here who are checked in, and I can work through them one at a time. So that's what you see on my end. And then eventually we meet. When it happens, your screen pops up, mine screen pops up, and it's very similar to the webinar here with the camera enabled, just like I could do here. So I can turn my camera on. You might be able to see me at this point, and we can have a conversation back and forth. Now, this webinar has disabled your microphone and has disabled your camera. Now, let me give you an example of a patient who was evaluated via telehealth. So this is patient JS, and JS is about 45 years old. He's at home. He has a couple of teenage sons, and they start wrestling, which is it sounds like my house. And JS sustained an injury. And so we met via telehealth, and he describes the injury where he felt a rip and a tear in his upper arm. And then via telehealth, he was able to show me this injury. And he had this bruising here right on his arm and near his chest. And it also looks a little bit thin here. And I thought he had a torn pectoralis muscle based on his history and based on just this appearance of his arm. And so we got an MRI, and this black line right here, if you can see my arrow, belongs over here by the bone over here. And that's what a torn pectoralis looks like on MRI. So I knew that he tore his tendon. And then we had a chance to discuss his injury and the options for treatment. And that was the beauty of telehealth in his case. The history gave pretty much the diagnosis, and then the virtual exam, just by the visual, I can make a diagnosis. Well, here's a different example. This is WB, and WB is about 50 years old. He actually suffers from pretty severe early onset Parkinsons, but he does incredible amounts of exercise, which have been unbelievably helpful for his Parkinson's. So he's been doing this for several years. And he was playing basketball at a socially distanced with one other person. They each had their own basketball, so it was safe. And he made a move, and he hurt his knee, and he couldn't walk. And he came into the office, and he came in right away. And what his exam and his history suggested was a torn quadriceps tendon, which is what we see here. This black, thick tissue here belongs firmly attached to the bone. But you can see that it's separated. And in fact, there's some other tissue that's interposed in between that doesn't belong there. So this thick black tendon belongs on the end of the bone, but it's torn. And that's something that requires surgery to fix, or else patients will have a disability over the long term. And so that's what we can see here. And so what kind of injuries are we seeing? Well, I call them confinement injuries. You know, a lot more people are wrestling at their homes. They're hurting fingers, wrists, and shoulders. So that's one of the things that we're seeing. But we're also seeing patients taking up new habits. They're bored. I'm going to try and get in shape during this time. I'm going to go for a run. And so we've seen those type of injuries as well, these overuse injuries. What we are seeing less of are the high energy injuries. We're not seeing the car accidents as much because there are many fewer cars on the road. We're not seeing pelvic and femur fractures. We're not seeing the sports injuries because no one's playing sports. So ACL injuries and shoulder dislocations and things like that are coming less frequently through the office. So obviously sometimes they're coming through. And so the majority of injuries that we see can still be treated with splints and casts and braces and physical therapy, thankfully. But there are some injuries that require surgery. And during the pandemic, and certainly during the beginning of the pandemic, we really limited the number of surgeries we were doing in order to preserve the PPE. And we limited this because we just didn't have enough of it. Now, if you do need surgery because your injury poses a threat to your life, or the threat to your limb, or the threat of the function of your body, please know that everyone is masked, everyone is screened, you're in a safe environment. And so having to go to a surgical center or to a hospital is a safe environment in the grand scheme of things. And the surgeries that we've been doing up to this point were for broken bones or deformed bones or torn tendons like you've seen, or for patients who've been suffering from intractable pain that they simply can't handle anymore. Now, elective surgery is a bit of a misnomer in my opinion. And, there's nothing elective about it really. What we really mean by elective surgery is that this is non-urgent surgery. It's still needed surgery and necessary surgery, but it's on a time scale that the patient and the doctor can pick a time and agree to it. And so those have been the surgeries that we've been postponing. And again, we postpone it to preserve the personal protective equipment, the PPE. And we've sort of uh, labeled surgeries that are not a threat to life or to limb or to critical function as elective surgery. And if you wanted to learn a little bit more about some of these issues, my father-in-law and I were on a ABC News segment that you might find interesting. You can Google it, postponement of elective surgeries, ABC News, April 23rd. I'm sure it will come up. And it's about 3 minutes long. It's an interesting piece. They did a great job of really outlining what the issues are that patients face as they're awaiting surgery. Now, prevention, an ounce of prevention is worth a pound of cure. And so during the pandemic, we really want to focus on preventing injuries. And God forbid you get an injury, do not neglect it, get it treated. But prevention is really important. And so part of it is just don't get injured. And again, as I mentioned earlier, some of the injuries that we've been seeing are where people are trying to get in shape. They're trying to pick up new habits, and they probably bite off a little bit more than they can chew. And they may end up with a very swollen, painful knee or a twisted ankle or a torn tendon like you've seen previously. And so, we have several physicians who posted on our Facebook page tips on how to prevent injury, how to deal with any injury that may occur during the pandemic. And these tips are available on our Facebook page. But in general, avoiding confinement injuries, there's always a temptation to have fun with your kids and wrestle with your kids. But just keep in mind that this is not really the time you want to be injured. And be careful taking up new habits. Go low and go slow. Start with low goals and then build up. I think people really just end up biting off more than they can chew. If you really want to play it safe and get all the exercise that you need, go for a walk. And you can make the walks more challenging by increasing distance or putting on a backpack. But the bottom line, walking is a very safe, very effective form of exercise. It builds your cardiovascular system. It's great for your bones, and you're unlikely to get injured. So during the pandemic, I've really been trying to encourage people to walk for exercise. Now, other things that can help prevent injuries are just good habits, good health habits. And we have this Ortho Health program where we're trying to help patients manage joint pain through these good health habits of sleeping well, of managing stress well, of eating a good diet, and exercising safely and effectively. And good sleep is so important for restoration and recovery. Stress management, when you're stressed, you tend to have poor metabolism, and it can really have a bad effect on your health. And obviously your diet. Eating a good diet is important during this pandemic. It's good for your immune system. And look, it's hard. We're stressed. We have lots of things going on that were not happening just 2 months ago. And it's tempting to have another drink after dinner or to eat another piece of cake and do the things that we know we shouldn't do because it feels good, it relieves stress. But if we can continue having a good diet, making good choices, it will pay off in the end. And so again, staying safe, staying immunologically competent, and avoiding injuries. So I just want to summarize. If you're injured, don't hesitate to seek evaluation. Telehealth is probably the safest means of evaluating, but realize it's a new technology that we are implementing. We're getting better at it week to week, but we're still at the beginning of this. It's at its nascency. And as we improve, we'll expand. But it's a wonderful avenue for people who just want to get something evaluated and are worried about coming into the office. But I got to tell you, if you do come to the office through an appointment or through our Ortho Access, you will see all the CDC guidelines being adhered to. You will see frequent hand washing. You will see frequent disinfection. You'll smell the frequent disinfection. And everybody's wearing masks. Everybody gets temperature checked. And it's far safer, for instance, than going to the grocery store. And there are just some injuries that need to go to the emergency room where the bone is crooked and needs to be straightened, or, and if you need to go, you need to go. So I don't want to discourage people because, again, all of these facilities are doing everything they can to keep patients safe. You yourself should follow CDC guidelines. So wash your hands, practice social distancing, use face coverings for your neighbor, and cover your sneezes, everything that was on that list, and then prevent injuries. And probably the part of preventing injuries is making good choices. Sleep well, eat well, manage your stress healthfully, exercise safely. Again, don't bite off more than you can chew as you start exercising. Go low and go slow, and then take care of yourself. It's okay to spoil yourself, and however that may be, but every once in a while, be good to yourself, because the pandemic has generally been bad to all of us. So take time to spoil yourself, find the silver linings in this. And finally, as we mentioned, the sleep, the stress, the diet, your exercise, really critically important to staying well during these times. I am going to put up a map here. These are the Ortho Access locations that remain open during the pandemic. You can always check our website if you have an injury that you'd like to have evaluated. We span all the way through as far south here in Illinois up to the northern suburbs. So there are plenty of options available if, God forbid, you get hurt and need a more urgent evaluation. The hours are slightly different than what people may be used to, have used our services in the past. And those hours will be expanding as, as some of the lockdown restrictions are lifted. So please check our website for further information. And so this would be a great time for questions if anybody has any. So I'm happy to take some questions.
Sure, yeah. So we do have some questions here. Someone wants to know if you are able to do stitches or sutures at an Ortho Access location.
So the answer is we are able to do that. And we do treat lacerations in the walk-in clinic, but really superficial ones. So all of us have done suturing in the clinic. You'll be seeing a physician assistant or a physician who knows how to suture. Actually, most of the time, quite honestly, many of the lacerations we can treat without stitches. We can treat with either the Dermabond, which is like a crazy glue for skin, or with Steri-Strips, which are special Band-Aids. But we do suture lacerations through the walk-in clinic.
Okay, great. Someone, and you can always say if you'd rather not answer, but we have someone that wants to know if spouses can enter hospitals with them the day of surgery.
So that's a very good question, and the answer is I'm not sure. Each hospital will have their own guidelines based on their burden of disease in the hospital. So hospitals that have been relatively hard hit by the COVID-19 pandemic will likely restrict people coming in. And again, the technology can be helpful. Speakerphone or FaceTime can at least allow the spouse to be a part of the preoperative time. Obviously, it's not as good as being there in person. Places that are less hard hit may have a different policy. So the answer is it depends, which is sort of a non-answer, but it does depend. And it will depend on the burden of disease for the hospital. And again, everything is being implemented to keep your safety, with your safety in mind. So if you are being asked to wait in your car, it's for your safety. It's not meant to separate you from your spouse or your loved one during a stressful time. It's really meant to keep everybody safe.
Got it. So someone hurt their knee back at the end of the year. It got better for a little while, but felt more pain in March with a normal X-ray. But wondering if they should go back in to get an MRI, or if.
So, patients who are having chronic discomfort, that is something that I think needs to be evaluated. And whether the pandemic is happening or not, you're still having a lot of pain. And so with those type of conditions, I do think another evaluation would be the proper thing. Now, whether an MRI would be needed or some sort of treatment, whether it's physical therapy or maybe an injection or maybe the MRI, obviously I can't speak to that, but because there's so much more that goes into it than just how long you've had symptoms. But certainly if you're having chronic symptoms for several months and they're not going away, that would be an excellent reason to be evaluated. And again, you just need to trust that at the facilities where you're going, that everything's being done to keep you as safe as possible.
Got it. So someone actually had gotten a treatment, had surgery with IBJI, but now they're currently in a different state and feeling pain and wondering if they should try to telemedicine back with an IBJI provider or if they should find someone locally.
Well, obviously both are options. There are some restrictions with telehealth across state lines, and those restrictions may have been lifted during the pandemic. But generally speaking, practicing telehealth out of state is not necessarily reimbursed by insurance. But I'm uncertain whether or not those restrictions have been waived. It may be worth a call to your insurance company just to check to see, let them know the exact story that you told me, and that if you had surgery but you're now out of state, but you'd like to reconnect with your surgeon, then by all means, you can call, set up an appointment, and do a telehealth visit. And the real question will just be whether or not insurance will reimburse for that on your end, or whether or not you pay for it. You can certainly reestablish care with a physician in your state, and there's some pros and cons to that, obviously, that they're local, and the con being that they're not the person who did your surgery, and they don't know as intimately the issue that was being addressed. So lots of factors go into that decision, but I would certainly encourage you to try and make a telehealth appointment with your surgeon, and then work out the insurance as well.
Great. So we did have somebody that also had just asked if telehealth was billed through insurance, like an office visit. You kind of had touched on that in your last answer, but I don't know if you wanted to take
Yes.
that.
And so it is billed like an office visit. It's somewhat dependent on the time that's being spent between the two people. But again, that's been the restriction that was lifted. The 29 states that before the pandemic were doing telehealth would allow it to be billed and reimbursed like a normal office visit. Now all 50 states are allowing it. And then I'm sure at some point there'll be more regulations and restrictions on how often it can be used or when it can be used, or again, state lines, things like this. But I want to be clear, I think telehealth is here to stay. I think it's been very useful for patients, and from my end as a provider, I found it to be very helpful in allowing me to really help evaluate some conditions that didn't require an in-person visit. So, and look, if it does require an in-person visit, it's kind of like a screening appointment where should I come in, you should probably come in. And so that's not infrequently the result of a telehealth appointment, is reassurance that, you should come in and get this evaluated.
Great. We do have just kind of a smattering of questions just about having some ongoing pain after surgery and wondering whether they should come in or whether they can kind of get a cortisone shot. And so I guess just speaking to definitely
Sure.
wanting to come in and
So general services after a procedure remain completely open, and whenever someone has a procedure, we rely very heavily on our physical therapists to take people through their recovery. And people should know that physical therapy remains open, and they have had to change the flow of patients through a therapy office to abide by social distancing. But the therapy unit is really they're actually at the forefront of the telehealth. They've incredibly accelerated the use of telehealth. And a lot of patients have really responded favorably because they don't have to take the time to go back and forth between the rehab centers. They're saving that time. They're able to do some of the exercises at home. And so I want people to realize that the therapy services remain completely available. And then for things like injections, or when the surgery hasn't completely alleviated pain, these adjuvant treatments remain completely available, and it's really just a matter of making an appointment. And so even though we're in a pandemic, it doesn't change the fact that we're here. And so if you have a problem that's like that, you can get it evaluated, and it's really a matter of building the confidence that you're going to get it evaluated in a safe environment. And I can just tell you again, and I keep sort of beating the drum, that it's important that wherever you go, that the facility is abiding by CDC guidelines of the frequent hand washing, frequent disinfection, everybody wearing masks, socially distancing, not crowding the waiting rooms, not piling on appointments so that people are at crowded waiting rooms. Again, these are some of the measures that we've taken that have been effective.
Great. We do have a few questions just about telehealth for physical therapy and asking if that is available, which it
Yes.
is.
Yeah, so again, just to reiterate, it's available and it's pretty much in high gear. And again, there's some limitations, just like there are with an in-person physician office visit, in that we can't perform a physical exam and your physical therapist can't touch the body part that they're trying to treat, which can sometimes be very helpful, both from a diagnostic standpoint, but also from a therapeutic standpoint, to be able to touch that body part that's hurt. But that being said, the therapists have also noted that they've had very effective means of treatment with their patients. And so it's available both in person and through telehealth. And depending on the condition, maybe you'll get all in person simply because it's better, or maybe telehealth will be sufficient. So, but the service is available. So I want to make sure that people understand that, again, the facilities are providing these services.
Absolutely. We do have a question from someone that is in Chicago that wants to know if there are any locations open there. I can tell you that there are locations open in Chicago. So if you want to check out our website, you can find the most up-to-date information. If you go to our COVID page, all of the locations that are both opened and closed are there, just so you know, before heading out. So the last question is, we have a nurse at an area high school. In the event that they have students with a suspected orthopedic or musculoskeletal injury, should they refer them to the Ortho Access walk-in clinics for now, rather than an emergency room?
Well, again, most injuries that present into the school, the athletes remain ambulatory. They can still get around. And so I would heavily favor seeing someone through the Ortho Access clinic. Again, despite the ERs doing their best to keep everyone safe, I just think it's in general a safer environment, because we aren't having patients come to see us with coughs and respiratory illnesses. And so the student athlete who's injured at school should absolutely come to one of the Ortho Access clinics if they need to be evaluated, in a timely fashion. There's also always the option, if the student athlete has a physician they've seen previously, to call and make an appointment. But we have our Ortho Access to allow for timely, convenient, thorough evaluation of these injuries that occur on the spot. And actually, the ERs have loved it, simply because we've offloaded their backlog of musculoskeletal injuries that may not have needed an emergency room visit. And quite frequently, it's not uncommon to go to the emergency room with an injury, get splinted, and then have to see the orthopedic specialist for your follow-up care. And you get quite a bill sometimes for that with the emergency room. And the Ortho Access is an office visit, and you get to see an orthopedic provider straight away. And so it's been a win-win for, really a win-win-win for everybody involved, including the ERs.
Great. Okay. I think that that pretty much wraps it up.
Hey, Maggie, I wanted to ask a favor. For those patients who are on the webinar, we'd really appreciate your feedback. If you wouldn't mind just typing in the chat if you thought this was useful or helpful. We just started this webinar series for our patients, and we'd love to get some of your feedback. And if you don't mind just chatting, typing into the chat box any sort of thoughts for what we did well or what we could improve, I'd be really grateful for that. And I know Maggie would too. So, but thank you so much for joining us. Maggie?
Yeah, thank you so much. Thank you.